it's still so hard for me to believe that that happened to me. I think
Yeah.
because as a nurse, I've run trauma. I used to work in pediatric ICU, and I've seen such traumatic things. And I think just knowing that something can change in a blink of an eye is so true. And I've seen that, but now that it happened to me, I'm like, oh my gosh, I I'm definitely more aware of everything. And I've always felt like I'm a good nurse, but I think I'm an even better nurse because this
Yeah.
happened to me.
Welcome to the place where we hear empowering stories of transformation and then we turn that into art that reminds us to be great. I am your host and artist, Jessica James, and this is the I Empower podcast. I don't even have words to say like how excited I am to talk to you because I think you have such a beautiful and touching story, and you are a maternal death survivor. And when I seen that, actually, I always like to tell my followers and my listeners where I get my guests from because they're always intrigued by that. I actually found you on TikTok, and I distinctly remember the video that popped on my Discover page was the one where you were talking, you were fine, you were in the hospital, you had the monitors on you, and then you talked about how within minutes that was when your world completely changed, your husband's world completely changed. And just to kind of give you guys a little bit of the knowledge that I know, you are an AFE survivor, which is an amniotic fluid embolism. I've actually never heard of that before until I seen your story. And then fast forward, I searched you on Facebook and I seen one of the videos that you had professionally made talking about your story where they interviewed everyone who was involved in your case. And when I say that, like, I couldn't hold it together, it was incredible. It was touching and emotional to see everyone else's experience and to see the different points of views. And I'm just so thankful that you're here with us today to tell your story, to educate. You're using your experience to just, educate the masses on this condition. So thank you, Nicole, for being on. I'll just have you tell us about yourself and what it is that you're doing after your surviving your survival.
Yeah,
Yeah.
absolutely. Thank you for having me. I'm so
Yes.
excited to help spread more awareness on an amniotic fluid embolism because, like you said, you had never heard of it, and honestly, I have never either until that happened to me. I've been a nurse for 10 years, and I
Yeah.
had never heard of an AFE before. So, yeah, like you saw on my story on TikTok, I never thought to get that many views for it, but oh my gosh,
Yeah.
it blew up like crazy.
Yeah.
Um, and I'm so happy, and I'm so happy you reached out to me. But yeah, the story is crazy. Was having my third baby, and on your third delivery, I remember telling my husband like, "Oh, this is gonna be a slip and slide. Like,
Yeah.
I'll
I'm a
be home.
pro.
I'm a pro. I'll be
Yeah.
home the next day. No big deal." And I completely got ready for it as I'm preparing for like, oh, my delivery gown and my socks and my hair and my makeup and my photographer. She's my best friend, and she was going to be in the room with us and everything. And I remember just sitting in my hospital bed, like you saw on my video, and I was just recording and so excited because it's my favorite part of having a baby is delivery. I just love everything about it. My husband hates it, hates it. He has asthma, so right before I push, like, I would have to show you a picture, but my friend caught him like taking a hit of his inhaler because he's like, "Oh
Aw.
my God, I gotta,
Yeah.
prepare to help and everything." And my deliveries were just so perfect. My past two, they're so easy, pregnancies and deliveries, and then the third one came, and I told my nurse that typically when I feel nauseous and hot, it's time to start pushing because I feel like, okay, maybe that's like a drop in blood pressure, the baby drops, and I'm fully dilated, and which I've been right the past two times. And so, literally, not too long after that, I felt nauseous and hot. And I told her, and she's like, "Okay, yeah, let me check you." And she checked me, and she's like, "No, you're only a 6." And I was like, oh my
What?
God, this is not, there's something wrong. And so my husband was like, let me go get you a cold washcloth. And I was like, that is definitely not going to work. And so she turns me over on my left side. And literally, that is the last thing I remember. Um, my husband then, from his side of the story, of course, told me as soon as that happened, I started to get red and I started foaming at my mouth and I kept saying I couldn't breathe. And so the nurse told him, here, grab a mask, put it on her face, let's try to hold oxygen on her. And then I turned instantly blue. And that's when they hit the hit the call light and yelled for a cold blue. And I'm sorry, I get emotional every
No,
time thinking about
it's
this.
okay. Yeah.
Um, they hop on me to start chest compressions. I actually even had a student nurse in there with me because I'm all about learning.
Yeah.
And the IV came out, which is, I mean, that can be normal. That's normal. I mean, you're in like a very crazy situation. And then they hurried up and got another IV inside, got another IV in me, and they're doing compressions all the way down. They all the way down to the nearest OR room. And they're moving me from my hospital bed to the OR table, and another IV comes out. And so there I was with no IV, no doctor, and I had no anesthesia on board. I did have an epidural, but I had no sedation to keep me asleep.
Right.
And they had paged my OB doctor. He still wasn't there. And so there's, 50 nurses just circling the bed thinking, we have to get this baby out right now, like it's not in a nurse's scope of practice to slice open a mom, right?
Right.
So luckily, an ER doctor came up to my code, which is not the norm because ER doctors don't have time to go to codes all in the hospital. They're so busy probably coding in the ER or dealing with, the craziness of just being in an emergency room department. And he walks in and he thought he was going up there just to be an extra set of hands, like maybe for an airway or something. And the nurse yells, she's been down for 7 minutes. You have to get this baby out right now. We've paged your OB and he's not here yet. You're the first doctor we've seen. And he picks up his pace. He feels for a pulse, and I have no pulse. And he knew right then and there. And he yells, someone get me a fucking scalpel. And they give him a scalpel, and he slices right into me and my baby. Um, After that, I started bleeding profusely, is what he says. And so now we go to the ER doctor side. So this is the ER doctor telling me exactly his side of the story now.
Right.
And so the ER doctor said that I ended up getting a pulse and a blood pressure back. So at that point, my OB doc and my trauma surgeon got there and he's holding down pressure and he's telling him, I don't know if I cut into an abdominal, artery, but she's bleeding. We got the baby out. And so they rush in. And he said the next thing he did was just go to the bathroom and cry because he was covered in blood and amniotic fluid. And he thought that for the rest of my son's life, that he would have to say that the day that he got his scar was from the day that his mom died because he thought I was dead. He really didn't think I would survive because mainly a lot of moms don't. It's either one or the other, it's never both.
Yeah.
So he goes down to the ER back to finish his shift. And at this point, my husband was told they were doing a postmortem C-section. So they asked him, do you want to gown up and kiss her goodbye? And so he did. He gowned up, kissed me goodbye. He's waiting outside the OR room. And a nurse poked her head out and said, hey, we're going to try to stabilize her. So just wait out here. And so he was waiting. And the trauma surgeon, gosh, I got like 48 units of blood. And the trauma surgeon, and my OB, they first closed me up. So they tried to save my uterus. Um, and they forgot to do a utensil count, which is completely normal because when you're in
Yeah.
a trauma code, there's
Yeah.
no time to count, there's no time. So he did an x-ray and he saw that there was, they left a sponge in me, which was saving grace because I still was bleeding out. And so
Wow.
that's when they opened me back up and saw that my uterus was still bleeding. And so they had to take my uterus, which was no question, you know, to save my life, right?
Yeah.
And then they left me open and were rolling me out to ICU. And my husband said that they stopped and they let him kiss my forehead. And he said I was just as cold as ice. I felt like I was dead. And so I still wasn't out of the woods. And I go back to ICU, and my nurse is running blood on me the whole night. I'm still bleeding, but they're just running and running. And mm, uh, everything starts to stabilize. I'm pretty sure my OB doc stayed the night that night. My trauma surgeon stayed the night just to be by my side and check numbers and everything. And they took me back to surgery to do an exploratory to make sure they didn't snip anything or make sure everything looked okay. And everything looked okay. And so I slowly started coming out of the woods. Um, and they were eventually able to start weaning me off of sedation. And so the next thing I knew, I remember I was restrained, my arms were tied down, and my husband told me like that they would talk to me and I would respond. I was so sedated, I don't remember any of that, but the NICU nurses would do like pictures of my son Haxton, and they would show me, and I would be like, I can't see him, I can't, like on the ventilator. I
Yeah.
don't remember any of this, but the one thing I do remember is right when they're about to pull the tube, and we didn't find out what we were having. Like we already had two girls, and I thought, you're probably like a girl dad. Like it's no big deal. Like let's just not find out on this one. And so we waited. And so once they pulled the tube out, I was like, "What? What is it?" And they were like, "It's a boy." And I was like, "Oh my God!" And then I fell back
Yeah.
asleep because I was so out of it. But I felt
Yeah.
like I joke to this day now that that is the most horrendous gender reveal ever.
Yeah.
You know,
Most definitely.
most
Oh my
definitely,
goodness.
yes. But yeah, so after after that, I felt things started to progress even quicker, and I was able to get off the ventilator, and yeah, it, I was discharged like exactly a week later.
Wow.
Hmm.
Holy shit.
I know you would think
That's
after all
incredible.
that trauma that I would be there, but no, they taught me, like they helped me get up and walk to try to get more strength and everything, and yeah, I was able to leave that hospital alive. I sometimes now when I drive by the hospital because it's by my neighborhood, I'm like, I almost didn't make it out of those walls, like,
Yeah.
but I did, and I'm so happy that my story doesn't end there, and I'm able to spread awareness about
Wow.
an AFE.
Yeah. Oh my gosh. It's an incredible story, honestly. And I did some like research before we jumped on the call,
Mm-hmm.
and I think I like Googled survival rate of AFE, and it didn't even like give me a number. It just said that it's so rare that the mother makes it from that. But then the infant, they gave a 70% survival rate for the infant.
Mm-hmm.
So that's incredible. That's incredible.
It is the first half when you're going through the AFE, and typically an AFE is diagnosed from an autopsy. Thank God that did not happen to me, but
Yeah.
now it's based on clinical presentation. So, how did this patient present? Mine started with, my cardiac arrest, and then it cascaded to DIC, which means I'm bleeding out, I'm not able to clot. And so I presented just like an AFE. So I think mortality rate is like 80%. The first hour, 50% die off. And then the
Yeah.
second hour, your chances go up.
That's insane. How common, you know, because I'm sure that
Hmm.
after you experience this and you're healed up and you're trying to process what happened, I'm sure you probably started going, I probably need to research some what in the world happened to me. Like I need to know more. So
Yes.
what like I just
I,
lost my
no,
question.
you're good. I am 1 in 40,000 is
Wow.
how, is what the statistics are for an AFE. So 1 in 40,000 moms don't live to see their baby. And
Oh my goodness.
60% of deaths, 60% of maternal deaths are preventable. However, AFE is not preventable, unfortunately. There's just not enough research, just like everything in OB care. It's so hard to study on a pregnant woman, right?
Right.
But I reached out to the founder of AFE. Her name's Miranda Klassen, and she's the one, she had an AFE, I think, 13 or 14 years ago with her son. And she started this whole foundation. So if you go to afe.org, you can actually see so many stories of other survivors and other stories of people who actually didn't make it either. So
Yeah.
it's amazing what the foundation has done.
Yeah. Oh my gosh. And what exactly is AFE? Can you explain to us like what happens when this happens?
Yeah, so it's when the amniotic fluid gets into your bloodstream and
Mm,
causes an anaphylactic reaction, and
yeah.
and it's crazy because it can happen on your first, on your second, on your third. It doesn't matter which one, and unfortunately, it's like, wow, why didn't this happen to me on the first two, right?
Yeah.
But it happened to me on my third, which I know, several women who it's happened to them on their first baby, and unfortunately, they lost their uterus on their first time, and so they can't.
Yeah.
Now they suffer, from infertility and not growing their family and everything like that.
Yeah. Oh, I'm just thankful, I'm thinking because I had I have two children. So my first child was in a hospital. I delivered her in a hospital, and then my second, we did it at a birth center.
Yeah.
And so we were just with midwives,
Mm-hmm.
and it's like in a bed. And
Mm-hmm.
I was at, I started in the bed, and then I moved to the pool. And one of the biggest fear, like my husband, when I told him that I wanted to do this with my second child, he's like, I don't know about this. This
Mm-hmm.
is scary. Like, what if something happens?
Mm-hmm.
And, so when we chose, most birth centers are close to a hospital
Right.
so that in the event that something happens, they can get you there faster.
Mm-hmm.
But I'm just thinking of like my putting myself into your shoes. You think that the further, the more babies you
Yeah.
have, the more
I'm a
the more
pro.
better, the better it gets.
Yeah.
You're like, ah.
This is
And I
nothing.
just,
Yeah. Mm-hmm.
yeah, and from what you're saying, there are no like like precautions that you could do to prevent something like this. There's no pre symptoms. Like it
Or
just
test or labs to do. It just happens out of nowhere. Nowhere.
wow.
And the best thing is early recognition, is your medical team recognizing it and
Yeah,
acting quickly, because every second counts,
yeah,
obviously I'm definitely pro-choice and everything, but if I was at a birthing center, I definitely would have died, or my son Haxton would have came out with cerebral palsy, or
yeah.
just because of the lack of oxygen, the delay of oxygen. And when they cut out the mom, the faster you can get the baby out, you get 30% of your cardiac output back.
Ah,
So
okay.
that definitely helped me. Now the hospital changed their protocol to where they do require an OB hospitalist on the floor, because when
Um,
it happened to me, there was no doctor. So we had to
I
wait. We just had to
know.
wait, which is so scary, so scary.
Yeah, like
So,
that was one of my like I was trying to take notes when like questions like popped up in my head when you were telling your story. That was one of the things that you said, and one of the things that I remember from the video that you have on your Facebook page, and that there were no doctors. There was nobody that could help you, and so like I can't imagine the panic that the nurses were going through, the panic that your husband's going through when there's no one there that can do anything, and just by chance, like you said, an ER doctor was like, let me go check on this.
Luckily, he showed up, and he called me a week after I was discharged, which I'm so thankful for. I think that really helped my healing, is hearing
Yeah.
the stories and stuff over and over again. Sorry, my son is
It's
he's
okay.
gonna
Yeah.
pop in.
He's like, hey, I'm going to say hi.
Say
Hello.
hi. He's
Oh my goodness. Hello. We
this
have
is
an extra guest on with us today.
this is actually, I can show you where he got cut from the ER surgeon.
Yeah.
Here,
Yeah.
let me show you. Come here. Anna, show her where your scar is. It's right here. Wait, turn around the other way. This way. Move your hand right
Oh
there.
my goodness.
So
Oh, thank
luckily,
you.
luckily it was right there and not on
Yeah.
his face, of
Yeah.
course. But yeah, there we go.
Thank you for showing that to me. Oh my
Watch out.
goodness.
Careful. Um, I'm sorry.
It's
What
okay.
was the
We
last question?
we were just discussing. You said that the doctor that
Oh,
helped you
yes.
reached out to you.
Yes, yes, yes. He reached out to me, and he got to tell me his side of the story. So that's how I am able to tell this full story, because I feel like some people on TikTok are like, "But you were dead. How do you know this? Like, how do you know these
Yeah.
pieces?" And I'm like,
Yeah.
"Well,
They're like
yeah." I'm like, "Well, obviously, everyone had to tell me what they saw." And so
right.
he called me and he was just like, "Nicole, I typically do not work days. I work nights." And I went into labor during the day. I typically don't work at this hospital. I typically work at the sister hospital, and I have two sets of twins. Um, so I work nights. Yeah, that's what he's saying. I have two sets of twins, so I work nights. He was like, but I felt something pulling me up out of my chair to get to you, and it just gave me so many goosebumps.
Oh my gosh.
Um,
Yeah, you're giving them to me
just
now. Wow.
how he felt it, and we stay in touch till this day, and um, I I don't know, I'm just so thankful. I'm so thankful to be here. I do get survivor guilt. I think that's
Yeah.
definitely a real thing, because I feel like even just the other day on TikTok I saw a dad who's he did his wife didn't make it. Sorry, he's holding his
It's
newborn
okay.
baby. He's holding his newborn baby and just telling his story, and I'm like, "Oh my God, that sounds just like my husband's story." And it just, I don't know. I don't know. I don't know why some people make it and some don't. And he was even at an amazing hospital. He said we were like at the best hospital, and she still didn't make it.
Hello, beautiful. I just wanted to pop in here really quick and remind you that if you love what you're hearing and you want to hear more of it, don't forget to like and subscribe to our channel so that you don't miss next week's episode of I Empower. And if you're feeling extra generous and you would like to give us a review, we would greatly appreciate it. Those help bump us in the algorithm so that more people are able to find these empowering stories to help them. Also, don't forget to check out the art that goes along with today's episode. You can do so at iempower.club or on Instagram at I Empower Club. And if you personally feel connected to the story and the art and you would like to purchase a limited edition print that goes along with it, you can do so on our website. As a reminder, all of the art sales go to support the podcast and help us continue this mission each week of bringing you empowering stories. All right, back to the show. I can totally understand where you're coming from with that, but everybody's story is different and everybody's body is different, and being able to, have, like you said, I'm sure like the doctors didn't do anything different with you that they didn't do with his wife. It's
Mm-hmm.
just one of those things that happen in life that there is no explanation for, but we just have to hold space for those people. But I
Yeah.
am thankful that you are here. So, you were talking about during your story, and I'm trying to you know, wrap my brain around it or wrap my mind around it. So they said that they thought that did you flatline? How did they get you to come back? Because I would have thought in this scenario that once they're like, okay, we just have to get the baby out, and then did they keep working on you? How did that focus switch? It's mind blowing to me that you came back, because you are maternal death survivors. So you essentially died,
Mm-hmm.
but then they were able to bring you back.
Mm-hmm. Yes, absolutely. I think um, ACLS, acute cardiac life support, um, them following that, medical professionals are certified in ACLS. And I think them going above and beyond with amazing chest compressions definitely helped. And getting a doctor in there to cut him out as soon as they could. This is actually called a peri-mortem C-section instead of a post, but my husband, they told him post. And
Okay.
my husband, he's not from the medical world at all. And so there's no
Yeah.
way he would make up that story. And so I actually had my chart printed from the hospital because if you get it on the laptop, it's so different than just
Yeah.
ordering, getting the
The
whole
paper
sheets, the
copy.
paper
Yeah.
copy. And so I did see it in there. They had my OB had said he was told that they were doing a postmortem C-section, that the patient had expired. And to put a label on yourself like that as expired, like, oh my God, I know things expire, but I never look at it as people expire, right? And so
Yeah.
I knew my husband was like, oh my God, wow, you heard these words. I am so sorry you heard this. I have been in code situations as a nurse where we do, let's time of death. We've
Mm-hmm.
always called it, okay, let's do a time of death, and then the doctor calls the time. But to hear being labeled like being like your husband saying expired and post-mortem is
Yeah.
crazy. So, but the life-saving measures that the medical professionals did that day really saved my life. The chest compressions, the recoil, how far you go in for chest compressions, it helps oxygenate all those vital organs, oxygen to your brain that you need and everything
Yeah.
because oh my God, I have no neurological defects. I I have
Yes.
none, and my son doesn't either. And I know a lot of AFE survivors who had strokes, and
Yeah.
they've had to relearn how to talk and how to walk again and everything. And I'm so lucky that that did not happen to me. So yeah, going back to that, it's literally called a perimortem and not post. Yeah, so they never called my death, thank God, but
Right.
they used those terms when they were telling
The
my husband.
yeah.
And yeah, it's so crazy because hindsight looking back, they kind of say like it's almost like I was getting prepared for this situation in a weird way, hindsight looking back. Before all this happened, I had told my husband, I need you to advocate for me if something happens. And he's like, advocate? Like, what does advocate mean? I was like, it means I won't be able to speak. Like, I need you to speak for me. And he was like, why are you saying this? Like, you've never told me this before. And I was like,
Yeah.
I don't know. And then another thing was I had gotten a vented patient that I was taking care of, and I told my one of my best friends works in the same department as me, and I was like, "Hey, come here," like. We, for some reason, started talking about like what our wishes are if we were ever on the ventilator. And then another thing that stuck out to me is I was reading the book of Matthew in doing a devotional in the morning. And in the book of Matthew, it talks about all of God's miracles, about him walking on water and healing the blind. And I remember seeing this scripture, and it said, this man went up to Jesus and was like, my daughter just died. I need you to bring her back to life. And I was like, I have never heard of this scripture in the Bible. I've never heard of this. I don't know if you have, but when I tell people this story, they're like, oh, yeah, I've heard of that. Yeah, I've heard
Yeah.
of that a lot of times. And I'm like, oh, okay. Well, I haven't. And
Yeah.
then Jesus like goes over there, brings this girl back to life, and goes back to the father and was like, she was just merely sleeping. And
Wow.
that stuck in my head a lot. And I was like, oh my God, I feel like I was just that girl, that woman, that daughter that was just sleeping.
Yeah.
So yeah, hindsight looking back, those three things like was so crazy to me.
That is crazy. I'm, you know, ugh, it's just it's an incredible story. You literally are a miracle being here with us and sharing your story.
Aw.
So, in all of this, and I'm sure you've had to do some healing, mentally as well as physically from what happened to you. Why do you think it's important that you tell your story?
I think awareness is key to knowing how to advocate for yourself. And a lot of women don't necessarily know how to advocate. I feel like bringing awareness with this certain topic makes women know the good and the bad because you don't want to go into delivery blindly. Um, I just think awareness is just, it's so important with everything in life, right?
Yeah.
Everything. And I get a lot of, not, well, yeah, I guess I do. I guess I get a lot of people, pregnant moms like, oh, this, I'm due next week. I'm scared and this terrifies
Yeah.
me kind of thing. But, oh, or don't tell your story. But it's like, do you tell someone who has cancer to not tell their story? Like
Right.
cancer awareness, that's huge, right? Like,
Yeah. Yeah.
and it should be the same with any kind of trauma out there. If you're able to tell your story, if you're in that point of like healing, I
Yeah.
strongly suggest you tell your story because it's helped me heal, and I guarantee you another woman feels the same way.
Yeah. Most definitely.
Hmm.
Oh, I think it's amazing what you're doing. And I'm, like you said, I'm such an advocate for telling your story. I think it goes really deep into the healing process of telling people, what you went through, so that other people who have experienced something similar, who may have had a traumatic birth experience, they can connect with you on that. And then as far as just the education, because, you know, like you said with the cancer, like you want people to be aware that these are risks and these are things that can happen to you, and that's why it's important that we mentally prepare ourselves for, the risks that could be involved with getting pregnant. And then, also just being that voice for the women that didn't make it, and realizing that it wasn't anything that, this is just my vision looking in on you telling your story, that it wasn't anything that those mothers did or didn't do, that, it was just a circumstance of, their experience with not being here. So,
Yes, yeah. And I think that's how change happens, right?
yeah.
Is by making awareness of something. That's how protocols are changed in the hospital. That's how, certain things in this world are changed to make, stuff safe, more safe.
Right.
So it's a
Most
really
definitely, yeah.
big thing.
Oh, yeah. Because, like, the more that people are educated about this, especially in the medical field, they can be more prepared in the event that something like this happens. And then also, too, just, factoring in making decisions on where you choose to have your children, too, can be, I like you said, I'm definitely pro-choice on having, like, where you want to deliver at. But at the same time, like, almost if I would have heard your story, it might would have changed my mind a little bit on
Where you were
where I
gonna,
chose to have them. Yeah.
and it's still good to research your hospital, asking about, okay, where are there OB hospitalists on the floor, like what does it look like? Are you a level one trauma facility? What level of trauma facility are
Right.
you? Or do you even have enough blood if something was to happen to me? Like that was going to be another
Mm,
problem at my hospital. They thought they were going to have to transfer because they were running out of blood. So, I
wow.
mean, there's certain things to still ask the hospital to try to make it as safe for you to deliver at as well, because, not all OB docs are good. I mean, there's certain reasons why people don't deliver in a hospital. And I completely get that. Like, for instance, African American women, they're 3 times more likely to die
Yeah.
in delivery or post birth. And yeah, there's just certain questions that you should be asking.
Yeah. Yeah. And, it's almost like, you having your checklist. I think every
Yeah,
woman has probably at some point made a
yes.
checklist on their pregnancy and what they do want and what they don't want.
Hmm.
And that's really good advice, checking the facility that you plan to have your child at to make sure that they are equipped to handle traumatic situations,
Yeah.
because you never know.
And just, making awareness is good for like nurses and OBs to hear my story because then it reminds them like, oh wow, okay, so me, we have educational things. Watch out. We have like certain certifications and renewing our certifications every month. Like they're reminded like, okay, what we do matters. Like me,
Yeah.
even though it can start to feel like unnecessary at times, but when your patient goes blue and limp, you know to hop on there and start chest compressions.
Yeah.
The repetition will kick in if and then it could save the life of two people and not just one kind of thing if something was to happen.
Yeah. Absolutely. Oh, so are you still treating? You're still working as a nurse now?
So yeah, I went back 6 months after, and I kept hearing like codes overhead, like code white, which means like so everyone at the hospital doesn't know. We have certain codes that they call overhead that
Right.
only us that work there know what that means, and so they kept calling code whites, which means mom is hemorrhaging, mom is bleeding,
Wow.
and I was just like, oh my God? Is this like a sign? Like what am I doing? Do I stay here? Do I leave? Like what do I do? And I think I still was having some PTSD and
Yeah,
everything. And
absolutely.
so I left the hospital and I became a doula. And so, I mean, this was a couple of months later after that, of course, too.
Yeah.
And I became a doula. So I love helping pregnant women and I love the delivery process. I just love being in there
Oh my goodness,
and
that's
helping all
amazing.
that. And I couldn't leave bedside completely. So I still work maybe like 2 days a week or so bedside as a bedside nurse. So I keep up my skills and my IV and
Yeah.
all that stuff.
Wow.
Um,
So how do you think that your experience has impacted you as a nurse and what you're doing?
oh gosh, it's impacted me as a nurse. It's still so hard for me to believe that that happened to me. I think
Yeah.
because as a nurse, I've run trauma. I used to work in pediatric ICU, and I've seen such traumatic things. And I think just knowing that something can change in a blink of an eye
Yeah.
is so real, is so true. And I've seen that, but now that it happened to me, I'm like, oh my gosh, I I'm definitely more aware of everything. And I've always felt like I'm a good nurse, but I think I'm an even better nurse because this
Yeah.
happened to me. Um,
Yeah.
oh, sorry. Uh, but yeah,
Ah.
and it's encouraged me to do blood drives. So I do blood drives as well.
Wow. Oh my gosh, you're doing such amazing things. Ugh. I just have a couple questions that I like to ask all my guests. So
Yeah.
if you don't mind, we'll jump right into that. If you could, and thinking back into like, after you came back with us after your experience, what would be the best piece of advice, knowing what you know now and being where you are now? Well, what would be the best piece of advice that you would give a younger version of yourself if you had a few moments with them?
Specifically to delivery, like
Yeah.
before all of that,
Just, yeah.
I would educate more. I would
Yeah.
definitely learn more about the bad than the good.
Yeah.
Don't just
Yeah.
worry about that going home outfit that your cute baby is going to be in for those pictures to post on Facebook.
Yeah.
Like, don't worry about that. Like, you need to do your research. Even as a nurse, like, how did I not know that you can die? You could actually, there's a possibility that you can die having a baby. You
Hmm.
know, I think you I think I wish I would have been told that. I wish maybe I was. I don't know. My head was so far under a rock because I was young, because I was
Yeah.
healthy and my history was excellent. I never thought that something bad could happen to me.
Yeah, and just me thinking from my own experiences of pregnancy, and so my first daughter, I had her when I was younger, so 24 when I had her,
Hmm.
and then my most recent baby just turned a year in December, so I'm 35. So like there was that age difference, but even so, approaching birthing at an older, more mature, air quotes, age, I still don't, there's a lot of advocacy for people saying that pregnancy is not a, an illness. You shouldn't treat it like an illness. And this is why, like, there's a lot of movement going with the birth centers and things like that. But I also, and I found myself in that pool of people who are saying, it's, there aren't that many risks, da 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 da. But then I speak with people like you who, your experience, had you not been in a hospital, you might not be here with us today. So that, and even though that your circumstances they were acting as quickly as they could, there were some things, some hurdles that you were able to overcome, and that the team that was working on you were able to overcome, so that you're here with us. But I'm just thinking there should be that happy balance of, yes, we don't want to treat pregnant women like they're sick, but at the same time, you really should do, like you said, your research and make sure that the facility that you are birthing at is equipped to handle trauma.
Yeah, yeah. For example, I brought up ACLS. It's acute cardiac life support that nurses and doctors have to get recertified every 2 years. Not every L&D nurse at every hospital is certified in ACLS. So that's a good question to bring up too. Is is your nurse's ACLS is your L&D nurse's ACLS certified? So yeah, there should be that happy medium, because birth is such a beautiful thing, but also a scary thing. Now I completely get my husband, why he was so scared, but it's like, oh my God, why didn't you ever tell me, like, that you thought I could die? Like, he never once spoke that, And I manifested the shit out of my birth, right? Like, you saw me speaking, like, my famous last words on that video was, "This is gonna be real exciting."
One to remember.
Yeah. So manifesting is not necessarily works every time. Just so you'll know.
I think that was one of the things that someone that I know who talks about manifestation and being very direct with what you put out into the universe when you manifest. So by you saying this is going to be an exciting birth, like, yes, this is going to, like, that's okay. The universe is like, or, God, whatever it is that you believe in, is like, do you want, how exciting? Like, what do you mean by exciting?
Yeah.
We can, so maybe say, this is going to be a healthy delivery. Everyone, like, I'm going to have a happy, healthy delivery, or, something like that.
Yeah, something like that, because obviously
be very distinct.
Be very distinct, because even though I was thinking good stuff, it's still, no, it's different.
Oh yeah, I'm a firm believer in the manifestation and inadvertently manifesting not so good things.
Oh yes.
Yeah. Oh my goodness. So I do have one last question for you, and then I will let you go to your beautiful family. We like to talk about power on the podcast, and not thinking of that as a bad thing. How would you think of, or how would you describe the type of power that you try to step into every day?
The type of power that I try to step into every day. Positivity pops into my head, and I am naturally a positive person, and I have 3 kids, and I have a husband, and I am just so thankful that I am here every single day. And so getting able to wake up another day, I'm stepping into that power of, like, I made this. I made it. I'm alive. I'm breathing. I'm doing this. Yes, there are times that, oh my gosh, some days are harder than others, right? Like, for sure. Oh my gosh, for sure. But I would say that you can react to certain things. Just don't stay there. Don't live there. You have to raise your standards, and every hero does it, right? Like, when the going gets, what's the saying? When the going gets tough, they keep on going, and they somehow find their power, and they, like, throw the car off of the thing. And that's how I feel. It's like, okay, like, I can do this. Like, it could be worse, but I would say what gives me the power is my family, is waking up to my family every day.
Yeah. That's so beautiful. You have such an incredible message, and I love that you are just sharing your story on all your platforms. I will make sure that I link the TikTok, the Instagram, and the Facebook page for you guys below, so that you can give Nicole a follow through her journey, and just, connect with other people who may be in in that community as well. But thank you so much for being on and sharing your incredible story with us.
Yeah, absolutely. Thank you so much for having me. So fun. You're so fun.
Yeah.
You make it so
Oh,
fun. It's
oh,
so
thank you, thank you. I
easy. You're
try.
such a natural.
Thank you. I want to thank you guys so much for tuning in today. I want to thank my guests again for sharing their incredible story of transformation with us. I have linked their social medias below in the show notes so that you can give them a follow through their journey. Also, don't forget to check out the art that goes along with each week's episode at iempower.club. If you personally feel connected to the art and you would like to purchase a limited edition print that goes along with it as your own reminder to step into your power, you can do so at our website. Don't forget to follow us on Instagram at iempowerclub, on TikTok at iempowerclub, and of course, YouTube at iempower. And don't forget to like and subscribe so that you don't miss next week's episode of I Empower. See you then.